Hi, my name's Sarah, and I'm going to place an IV catheter into the cephalic vein of this dog. So I already have my chlorhexidine alcohol scrub. We use T-ports here, so I have a T-port, and it's already flushed through with heparinized saline. We're using a 1 to 10 dilution, so it's 3 units of heparin into 3 cc's of sterile saline. I have sterile gauze, some vet wrap to cover my catheter with, and tape for once it's placed. So we're going to go ahead and get started. I'm going to bring us in for a little bit of a closer look. And my assistant is going to hold our patient here in sternal recumbency while also holding off the vein. And I'm going to come over here instead so you can see a little better. Okay. I'm going to shave first.
Good sleep, Rebel. Good boy.
Alright. And then before I scrub, I'm going to open my IV catheter. I have some heparinized flush here. And I'm just going to remove that top port, holding it by the bottom, connect to my catheter, and flush through so that it is preloaded with heparinized saline. I'm going to unscrew it, connect it back to its needle, and then put my cap back on here. So then I'm going to go ahead and put some gloves on and scrub.
You're okay, Cuervo.
I'm fine.
Okay, little guy. Okay. Kim's a good boy. Cuervo's a good boy. Kim's the best boy.
Alright, now that we're nice and scrubbed, I'm going to get a piece of my sterile gauze and place it just below where I'm going to be poking. And I'm going to uncap my catheter. Making sure it's bevel up. And then I'm going to insert parallel to the skin. Notice the flash in the hub. And then I'm just going to feed it. I'm going to put my stylet to the side so that can be placed into the sharps container when we're done. Place my first piece of tape.
You're a good boy, Cuervo. No, hold on. No, the tape feels weird, doesn't it, buddy? Tape feels weird. Kim's a good boy. You okay?
And tape's going to keep hold of that elbow for me. piece of my sterile gauze out. Slide it up under the catheter so that I can attach our T-port.
Excellent job, Cuervo.
Make sure that's nice and screwed on. I'm gonna go ahead and flush through the T-port.
Feels good.
And then I'm gonna flush through with my additional 3 mils of the heparinized saline so that we avoid getting a clot in our catheter. All right, so I'm just gonna finish taping this in. Alright, that feels good. I'm going to go ahead and cover this with vet wrap. I'm going to cover this port down here as well as our lower lock port so that everything stays nice and clean. And then I'm going to take our stylet and put it in the sharps container. And that's how you place an IV catheter in the cephalic vein of a dog. So some possible complications with IV catheters include patency, which means that your catheter is actually inside of the vein that it's supposed to be in. So if a catheter is no longer patent, whatever you're putting through that catheter is no longer going into the vein itself. It's either going into the sub-Q space around it or it's been removed completely. Either way, it's not going where it's supposed to be, which is into the bloodstream. This can be a big problem, not only just with fluids, it can build up around in the sub-Q space, but if you're giving any medications that are specifically supposed to go IV and they end up going perivascular or into the sub-Q space, they can be, if it's something like dextrose, that can be significantly traumatizing to the patient and very painful and cause some skin sloughing, or the medication might simply not be absorbed in the correct way. But most of the time, medications that are meant to go IV should be given IV, so you always want to establish patency of your catheter before you administer any medications that way. Another common problem is phlebitis, so actual inflammation around the catheter from where the vein is getting inflamed and all the skin around it is getting inflamed. So you always want to check for that. It'll be red, irritated. Normally there's some swelling, warmth there from the irritation. That would warrant removing that catheter and possibly placing a catheter in a new site. You can also have issues with infection. Catheters are a direct access to the vein itself, so to the blood. So it's a very easy way you're giving bacteria a direct route. So whenever dealing with an IV catheter, you should try and maintain the most sterile procedure possible to just avoid introducing any bacteria into the bloodstream, which is sterile. So one of the most common issues we can have in the veterinary field with IV catheters is a patient chewing them out. So the easiest way to prevent this is giving the patient an e-collar. It's much better to just go ahead and put that e-collar on the patient than to assume, oh, they're fine. I know I've seen a lot of people do this with elderly patients where they think, oh, you know, they're older, they'll just leave it alone. And just taking two seconds to put that e-collar on can save you a lot of time, and it saves the patient an extra poke when they do chew out that catheter. So we just want to maintain patency at all costs. And with that comes every 4 hours you should be evaluating your catheter at the minimum. You should, if they're not on fluids, or even if they are on fluids, you should run a flush through and just double check, make sure that you actually confirm that the catheter is patent. Just to make sure that everything that you're administering is going where it should be in the right way.